Can I have Botox at one clinic, then go to a different one to get more? I know you can't have a lip filler done by a different nurse or clinic until after 6 months. Wondering if it was possible to do it with Botox, though, before 6 months, as my nurse is away for a couple of weeks.
Thank you for your question. You submitted a question without a photo, and you're asking about a situation where you know not to get lip filler beyond 6 months going from one clinic to another, but you're asking if you can get Botox from a different practitioner because your provider is going to be away during a time when you would typically go. Well, I could certainly give you my thoughts about this type of question. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years, and I've been using Botox and fillers since almost the beginning, particularly Botox, because our specialty was one of the first to use Botox, oculofacial plastic surgery for facial spasms and ocular indications. As far as that question is concerned, I think that it's very important to understand that these procedures are not generic, and that although the companies that sell these products, whether it's injectable filler, neurotoxin, or lasers, promote the names of these products, I would remind you that the products are as good as the practitioner that performs the procedure. So, the question is, can someone else who doesn't know you do an equally good job as the person who you've been going to? That's difficult to say. I think that in this very open access world of aesthetics, I think consumers have tremendous opportunity to search for people that work ideally for what they want and ultimately I would advise, look for someone who can provide them with consistent results. Now, yes, people sometimes come to us who are here in New York on vacation and they missed their Botox appointment somewhere else and they wanted to get some Botox while they were here in the city. And that's fine. For certain areas, going to an experienced practitioner, you can simply make a good assessment, whether it's for like crow's feet lines or frown lines, forehead lines, or anything like that. You look at the muscle activity and you dose according to your best judgment. So that being said, I think that certainly if you can find somebody who you feel comfortable with and maybe advise them to be more conservative so you don't get more than you need, I think that it's likely to be safe. It's important that you feel comfortable. But I would also remind you that it is best to be consistent and go with a practitioner that you feel comfortable with and you're getting the results you want. Now, there is a wide range of expertise and experience amongst practitioners with neurotoxins and injectable fillers. And sometimes, like when people come to us for, let's say, a filler such as Juvederm or even Restylane, the approach and technique is also sometimes something they've not experienced before. So it's something that, without disparaging colleagues, it is your option to, of course, perhaps even look for someone who will be able to provide you with what you want, and maybe you'll take that opportunity to learn about other things that they may do that your practitioner currently doesn't do or hasn't discussed with you. So an educational opportunity is always there. But I would emphasize, make sure you're going to somebody who is, I strongly recommend physicians who are highly experienced and you feel comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.